everyone. I wholeheartedly agree with what you had to say, Gene. But one of the things I'd like to add to that is so wonderful. This. I see something happening here where there is a return. Well, years and years ago, if you remember when we were young, that those folks, Christians, were the ones who had those positions of service, and outside from their, just from their faith, those that were with social services was mostly done, was mostly Christians, and I see somewhat of a return to that, and there was a level of empathy and sympathy that they had for working with people. And one of the things that we all know have been preaching for the longest is that no one can speak to the whole person like the church can. And it's so refreshing at this point in time to still see those of us that are connected to our faith. And it allows us to do the work that we're doing in our professions. And it gives us a different level of connectedness and intuitiveness, which is what I love about our first speaker, Dr. Holmes. She's not only a professional, but she's also a woman of God, and her profession leads into her faith. But it also guides the way that she does her work, and it also gives her a level of insight, because she's over, she attends Faithful Century, and she's over the counseling ministry there. But she's also a psychologist and a professor at Antioch, and has a long-standing history in community. And so it's like a double edge there, that she's able, but there's that level of insight, that level of Christianity give you a level of insight that others can't really understand and see, that allows you to do the work, and you're able to minister in a way that some folks don't understand. So without further ado, we'll let Dr. Holmes come forth and do her thing. Dr. Holmes.
Thank you very much for that wonderful introduction. I'm so happy to be with you this morning. I will not take up much time, but I want to say that I'm really honored to participate in this. I've been participating in the weekly Los Angeles County ministers COVID debriefing calls that have been happening every Thursday, and they have really been a blessing to me because of the information that has been shared, and also a blessing in that the county understands the role and the importance of the faith community and churches and Christians in the midst of these trying times. I'm going to share my screen with you, and I also put the PowerPoint in the chat box for those of you who are on Zoom. So you should see the a PDF of the PowerPoint, so that you can have a copy of what I'm talking about, and you don't have to try to write everything down. And I'm going to try to keep it to 20 minutes, but of course, so that we'll have time when it's over. So if you have any questions for me, please feel free to save those through the end, or to put them in the chat box. So I'm just going to go through these few slides that I prepared to provide some information about the church and the role of the church in this COVID-19 pandemic. So I just wanted to start off with some statistics that I received from LA County Public Health and also the CDC. So currently the data was gathered on April 30th and then reported on May 1st. And you can see the number of cases in the US alongside the deaths. Only a few counties are reporting those who have survived or recovered, so that data is not readily available for everywhere. For example, Los Angeles County is not reporting that. So as of the 30th, there were 24,215 confirmed cases in LA County, and 1,172 deaths. And you'll see in LA County and then also in the United States, I wanted to also show you uh, how this breaks down by race and ethnicity. Because one of the things that we are noticing is that there are disparities between the number of cases that are being reported for different ethnicities, and then the percentages of those who are dying from the disease. And so, if you will notice, I was going to ask this question, but for the sake of time, I'll just tell you. So interestingly enough, if you look at the number of cases within the African American community compared to Latinos, whites, and Asians, the number of cases is lower. But if you look all the way, and this is for California, and if you look all the way to the last column, the last two columns on the right hand side, you will notice the last two columns. One says percentage of deaths, and the other says the percentage of California population. So if you look at that column between Latinos, Asians, and African Americans, African Americans, although only 10%, although only 6% of the population in California, they represent 10% of the deaths. And between those four groups, for African Americans are the only group for whom their percentage of population in California is lower than the percentage of death, or the death rate. So for the only group, for Asians, they're 17%. For African Americans and Asians, because Asians are 15% of the population, 17% of death. African Americans are 6% of the population and 10% of the deaths in California. So I think that that's really, really important. And there's, of course, a lot of medical hypotheses for this, for these disparities. And one of the major ones is that the health professionals are finding that there's a higher likelihood of death related to pre-existing health conditions such as cardiovascular disease, hypertension, and diabetes, which we all know are higher within the African American community and are linked to a lot of factors: environmental factors, oppression, racism, access to healthcare, all of that. But I think it's important for us to know, as we move forward in this conversation, that African Americans are disproportionately dying from this disease than other groups. So let's talk about COVID. I wanted to talk about COVID and how it's different from other medical epidemics and pandemics that we've seen in the past. For all of the others, SARS, H1N1, Ebola, for all of the others, generally there's a core group of individuals who are impacted either by the disease itself or the regulations that are put in place because of the disease. And then the circle moves out to those who are affected. Then it moves out to those who are aware of it and are inconvenienced, and then the circle moves out to those who are unaffected. So, and then lastly, there's a group of people who are unaware that there is a pandemic or an epidemic happening and are unaffected. So usually you have multiple groups of people, and the people who are unaware and unaffected, or who are aware and unaffected, are usually the people who are able to mobilize and share resources because they are not affected by the pandemic or the epidemic themselves. So usually there's a group of people who are not affected but can share resources, whether it's time, money, ideas, or skills. The way that COVID differs is that we don't have people who are unaware and unaffected, and we don't have people who are aware and unaffected across or around the world. Around the world, everyone is either deeply impacted, and those are individuals who are suffering from the illness, have loved ones or close relatives who are suffering from the illness, people who have died, or healthcare workers who are working around the clock, or people who are running essential businesses who are being faced with potential infection every day. So we have a large portion, majority, are deeply impacted. And then we have a smaller group on the outside who are aware and inconvenienced. And so those are individuals who, up to today, this point, have not been deeply impacted, but they're inconvenienced. Yeah. So around the world, that inconvenience looks like safer at home. For some is an inconvenience because we see them, rioting in Georgia and South Carolina because they want to, and also now Newport or Huntington Beach.
Yeah, Huntington Beach.
Here, even closer, because they're inconvenienced. I want to go to the beach. I want to get my nails done. I want to get my hair done. So they're aware that there's a pandemic, but they're inconvenienced. And so it's time for us to kind of think about how, and I don't even want to say it's time for us to think about it, but we have to be mindful that there's a juxtaposition. So you have a whole group of people who are mourning the loss of something, someone, or something like a job, or fear. And then you have this other group who seems to be clueless because they're just inconvenienced. They know that there's something. So there's kind of like this juxtaposition, and the people who are mobilizing to help, who would have been in that aware or unaffected group, or those two unaffected groups, now the people who are mobilizing are the same people who are deeply impacted. Mm-hmm. And so you have wounded helpers. Yeah. Who are mourning the losses of people, of their own health, of their own jobs, of, various things. But they're the ones who are mobilizing to help. And so that's the first thing that I want us to be aware of, is that the carers are often the same people who are the carees, who also need to be taken care of. And so throughout my presentation, what you will notice is that I will give you some tips on what to do, but a huge part of my presentation will include questions for you to answer with your congregations, with your families, with your communities. And so on the slides, I'll have questions for you to think about and to answer those given the unique situations of your congregation, of your communities, of your families. So because we know that if we say that, they're wounded helpers, asking the questions, then how will this impact the ability for people to share resources? If I'm wounded, if I'm dealing with my own lack, then whether it is an inside lack of emotional well-being, or something tangible like I lost my job, so I can't really give financially or food. So how will that impact? How will that impact resources, and how will that impact the relationships as well? Mm-hmm. And here is, where we need to think about the role of the church. So then how does the church then step in and be that bridge or fill that gap, knowing that these wounded helpers and healers are also part of the church? So when we think about, I'm going to talk about the Black church. So when we think about the historic role of the Black church, I'm preaching to the choir. Even Minister Booker talked about this when he introduced me at the beginning of his introduction, that the Black church has always been centered as an institution within the Black community to meet the community's needs in various ways, and met the community's needs at a time historically when the United States would not allow for Blacks to access any governmental services that might have been available. And so the church stepped in to meet all of those needs. Erickson quotes Fraser and says that they identified 5 historic roles of the church. Historically, the church has served to meet the needs of the family, to meet the needs of economic leadership, to meet the needs of political power, to meet the needs of education within the community, and also to meet the needs for healing in the community. And so the church has always historically been a place where Blacks in the community have looked to for guidance in all aspects of their lives. Minister Booker talked about the church being the only place to meet the whole person or to serve the needs of the whole person. And this has been backed by theory and literature, that is the role and has been the role of the Black church. I often, when I'm doing presentations, talk about the Black church as the first social service organization. You know, in our country, we have this separation of church and state, but the church has served and filled in the gap when the state, the political infrastructure wouldn't support us because we didn't have access to that. And so what we're finding, though, is that has not changed for Blacks in America across the years. Across the United States, groups are, across ethnic groups, they are not endorsing religious or affiliation as much as they have in past years. And so religious affiliation endorsement is declining across all ethnic groups. However, for Blacks, there is the slowest decline. So this study was done in 2017. And if you look at the chart, Blacks endorse attendance and religious affiliation more than any other ethnic group that was surveyed. So more than whites, more than Asians, more than Latinos, more than anyone who subscribed to others. So we're still almost at 50% endorsement of not only church affiliation or a belief in God, but that we are attending church services. We do that more than anyone else. Another interesting finding in this survey was that, and this is where the church is critically important, when asked in 2017, so just 3 years ago, where do you go for information or sources about what is right and wrong, how to live, what to do and what not to do? More Blacks than any other group said that they go to their religious leaders. So Blacks are still looking for guidance and understanding of what they should do and what they shouldn't do and how they should live from the church than any other group, which is important because it speaks to the power of the pulpit and it speaks to the power of those of us who consider ourselves Christian, connected to our religious organization, and what are we saying and how are we ministering to those in a time of suffering or even when it's a time of prosperity. That our congregants, more Blacks are coming to church and attending church, and more Blacks are looking to the church to tell them what is right and wrong and what they should not do, which is so important for this pandemic because we are dying more, we have a lack of resources, and we're looking for the church to tell us what to do. And so it's important for the church to have accurate information and to keep its congregants safe. So that's the second point that I wanted to make. And so for those who are deeply impacted, going along with what Minister Franklin said, that this is mental health month, and this is what I do. So talking about how are those individuals who visit the pews 1, 2, or 4 days a week looking for connection, looking for spiritual guidance, and how to walk out their lived experience on earth. How are those individuals impacted? And in the same way that the church has an opportunity to speak to the whole person, it's the whole person that is impacted by this experience of COVID-19. And so I'm going to just talk briefly about each of these for the sake of time. And I've touched on some of these in those Thursday minister debriefings. So what are some of the emotional impacts? Well, Two of the major ones that we know are happening is uncertainty, because no one knows when this band is going to lift. No one knows whether this is going to peak again, as they're saying, next fall or next winter. No one knows really, truly how it is truly transmitted, how long it lives in the air. So these things, we're in an era of uncertainty. But what we do know is that we are going to have a new normal. There has had to be change, and there's going to continue to be change. And for many individuals, uncertainty and change equal very distressing emotions, such as fear and anxiety, sadness, loneliness. I'm the only one that's feeling this way, or I'm separated from my church. I get connection, which is where I socialize, which is where I'm fed through my interactions with fellow Christians, through our fellowship, and so I'm lonely. And for some individuals, and this is kind of coming, given that we've been on Safer at Home for about 6 weeks, for some individuals, they're also finding ways to be thankful. I like to coin the term. Some people are now moving to finding COVID blessings. Finding the blessing within the COVID. They're finding that they are being more neighborly. I had a neighbor stop by my house and ask about my grass yesterday that I've never seen before. She said she lives in the neighborhood and she was taking a walk, and I was getting a package off the porch, and we stopped and had a conversation. And so, people are finding COVID blessings. So the two questions that I would leave with you as it relates to this, as you're thinking about your congregations, as you're thinking about your church family, answering what fears and anxieties is COVID triggering for you individually. Remember, the wounded helper. So assess yourself. What's coming up for you? What's coming up for your leaders? What's coming up for your church bodies? And then how can you acknowledge that? The second question is, how can you address these fears and anxieties at the same time spreading the gospel of truth, which is a balancing act, right? So you want to acknowledge people's real experiences and their fear, because it's real. We don't know what's going to happen. At the same time, standing on God's word, and as Minister Franklin said when she started, is that this is going to pass. It's going to move. But how do you balance those two? So how do you not dismiss it? And how do you still remind them that God is on the throne and he's in control? Secondly, what are the relational and social impacts? And this has been talked about a lot in the media, so I don't have to spend a lot of time on, what social distancing, what impact social distancing has and how it affects people in feeling alone. But I touched on this on the Thursday debriefings. For many people, there's an extreme feeling of loss and grief, and that loss and grief is both tangible and intangible. So some tangible losses that we think of are loss of ability to truly interact and connect. Like the other day, my brother brought my little niece. I only have one. She's 3 years old, who I take care of a lot, but I haven't been able to be around her. So they came and stood outside the window, and I'm talking to the baby through the window. Like, I can't pick my baby up, right? So tangible losses and being able to interact and be with your loved ones, loss and grief, tangible losses like death. So there are many people, when you look at especially the way that the virus has impacted the African American community, I would probably safely guess that if all of us on this call haven't known someone directly who's passed away, we know someone who knows someone who lost someone. So we're really only two degrees away from COVID death. And the way that we're able to grieve and mourn and begin to ritualize those deaths taken away from us. No longer can we have a large funeral ceremony because you can't have more than 3 or 4 there. No longer can we get together at the house and take over food, have a repast. So we've lost a lot of those things, those tangible and intangible things. So again, questions here. What does the church community look like considering social distancing? Because we are a community. So what does that body look like when it's disconnected from itself? How do we make use of this new common bond experience? So how do we use that we're all experiencing loss and disconnection from the physical church body of fellowship? So how do we make use of that to build relationships? And also, I thought this question was really, really interesting. And how do we touch on this in our Bible studies and in our Wednesday night services and our prayer meetings and from the pulpit? What idols is this crisis revealing in us and in our church? What idols? Because I would say if I'm going to risk my life to go and get a set of nails, that's an idol.
That's right.
That's an idol, because God gave me life, and how dare I not cherish it because I'm going to get something that doesn't glorify him. So what idols are being identified? Of course, we know the spiritual implications, but again, I look at this as like how the intersection of spirituality and mental illness or mental health. So one thing that came to me, and as I was talking to some of the clients that I work with over Zoom, is that individuals have begun to question their faith. God, how could you take my, I know someone who was married 32, since she was 19, 32 years, and her husband caught COVID 54 and died. He had hypertension, but 54 and died, and left her with two adult children, but 2 children who are under 18. And now she's like, why him? Right? So she's asking those questions. Why him? Why all these other people recovered? At the same time, this same individual and other individuals that I've spoken to are experiencing shame around questioning their faith. I should have stronger faith. I shouldn't question God. I know better. I'm not a babe in Christ. Now I feel ashamed because I'm questioning, or I'm afraid, right, of this, because God didn't give us a spirit of fear. So now I have shame that I am fearful or that I'm tearful. And of course, spiritual implications I mentioned around being disconnected, and also the change in our worship service, right? So we don't have praise and worship in the sanctuary. Are we engaging in praise and worship in the same way that we did in the sanctuary through Zoom or through Facebook Live? So how's that changed our worship and our ability to connect with God and outside of the sanctuary? So again, two questions. I'll just read the last one. It's really important for the body of Christ to really examine their theology around suffering. So how are you talking about God and Jesus in this time where individuals, large groups of individuals, are suffering? So what's the theology around that? And I'm almost finished. Of course, we know there's some physical impacts. Individuals working from home, decrease physical activity. There's a lot of memes going around social media talking about how much increased eating is happening because people are at home. They can't do as much as they used to. So everybody's snacking, which increases body mass and can again expose you to pre-existing conditions such as diabetes and heart disease, which is linked to obesity. Also, a decrease in managing pre-existing conditions. Individuals are not going to their doctor's checkups or not getting their blood drawn because they're afraid that people in there will have COVID. Right? So they're like, I don't want to get sick, so I don't want to be where sick people go, so I'm not going to get a checkup. I'm not going to go and get my quarterly blood draw. So, so again, questions at the end that I won't read. The presentation is there. Some psychological impacts, and I talked about this on one of the calls on the ministers debriefing, and then also Mark Ridley Thomas's office the next week touched on this. People who already have existing challenges or difficulties, those are usually exacerbated in times of crisis. So individuals who are struggling already with depression, for example, or substance use, or anxiety, or suicidality, those things heighten in the time of crisis because their equilibrium is thrown off. They already have difficulty coping, and then you throw crisis in there, and they become very disorganized, and they have difficulty kind of maintaining. They can't use their usual way of coping to deal with the additional feelings that are coming up. And so one of the things that I talked about, and it was talked about on the call from Mark Ridley Thomas's office, is that the child abuse hotline has noticed almost a 50% drop in calls to report suspected child abuse. And at any other time, we might be able to say, oh, wow, maybe child abuse is decreasing. But what we know is that a huge number of reporters of child abuse were teachers. And now that children are not in schools, their bruises, whether they're external or emotional seen through behaviors, are going unnoticed because they are locked in the homes with their perpetrators. And so they're outside of the eyes of those who would make those reports. And so it's important for us, those in the faith community who are having interaction with parents and children through Zoom, to pay attention to those things that we might be able to see. Does the child have on a turtleneck and it's 89 degrees outside? Does the child have on long sleeves and a jacket? So are they covering up bruises? Are they withdrawn? Do they not want to talk to you? If you're having Bible study and you see, there's a parent that keeps muting their mic or turning off their video, but they're yelling at kids in the background, how are they handling that stress? And it's the same for those who are in domestic violence situations or where there's potential elder abuse. These individuals don't feel that the safer at home order accurately describes their situation, that they are not safer at home, that they actually are in danger when they're outside of the eyes of other people, such as teachers. And so it's important for the church and the congregants to remember that. Okay, and I'm on my last two slides. I'm trying to run through because I know the sake of time. So within this pandemic, there has been a major reorganization in this time of crisis, but we also have to remember that this crisis is bringing us opportunities as well. So how do we embrace those opportunities, not only for today, but remember that we have to be prepared for a new normal, that everything that we implement now will not go away when COVID is a long memory. So although we're canceling physical services and classes are moving online and you're not able to collect offering in person, having technology can help you keep the same rhythm, time, and content of your sermons and your services and your classes, and being able to use things like Zoom and phone to continue with ministry support. Some churches are instituting buddy systems where members are checking on each other, or members are asked to call at least 2 other members a day. And so people are actually talking to and interacting with people that they wouldn't have or hadn't in the church sanctuary. Opportunities for things like neighbor prayer walks while taking the same precautions, and developing new ministries like shopping ministries for those who are vulnerable or infected, where you don't even have to touch those individuals. The reason that I bring this up in the context of the overall presentation is that the church is now being called back into the role of meeting the needs of the entire person, the parishioner, the church body, and the community is in need. And so it is important and crucial for the church to share accurate information with its congregants, share accurate information and resources through sermons and through other forms of communication, such as pamphlets, emails, prayer meeting updates, to share information, because they are looking to you. The research shows that they're looking to you to help them to understand, okay, well, they're protesting in Georgia. Maybe I can just go out. right? Maybe I can just go out. Maybe they need to hear, wait a minute, the governor of California said not yet. So sit back, because they're listening to you for what's right and wrong. They need to also, this accurate information and resources, they need to hear, which is where, the second bullet point, that you are able to address the realities of their life right now. So that goes back to being able to address people's fear and meet them where they are, or whatever their struggles, depression or substance use or substance abuse. So meeting them right where they are right now, at the same time holding them up and spreading the good news that they need to be able, but they need to be able to hear that you understand that, you know, they have an impact psychologically or physically or emotionally. So they need to be able to hear that. Number 3, that in some ways we as Christians have to make sure that we have that we are providing a resource for those who are struggling. If we are wounded, but we're able to help others, how do we become a resource for those who are struggling and need some help? And then lastly, being able to speak light into the, to speak life into the current state of affairs, knowing that this too, as Minister Franklin said, shall pass. So one way to speak life is to say this too shall pass. Additionally, what can help to fortify that is for the parishioners to see and hear the church planning for the future, to begin to talk about, now what's our next step? How are we going to adjust to this new normal? Let's begin to make plans for tomorrow, for next week, for next month, for 2020. That we know that unless God comes and gathers us all up and takes us home, that we're going to continue until he says that our time has ended. And so being able to show parishioners, we're, as a congregation, as a church, as a pastoral leadership team, we're starting to make plans and think about the future. And you should too, for your homes, for your family, for your jobs, all of those things. So those areas and roles of the church is so critical and crucial, because people are looking to us for guidance. So the last slide is just a slide of resources that you can go to, that you can share with those who are struggling. So some 24/7 helplines or text lines, so you don't have to be that person on call, because you have to take care of yourself as well. There's medical information talking about how the coronavirus differs from other viruses. Links to the CDC. The CDC has guidelines for faith-based organizations. So just some resources for you. And then my contact slide. So again, the slides are up in the chat. I did them, put them as a PDF, so you should be able to download them if you want to keep them. And that's my time.
Oh, thank you.
I shared it.